you so much for joining us. This is Doc on Air, and from the title itself, you know that we have a doctor on air for you. And today we are talking gas. How many of us are suffering from this? What causes this? What is it, and where is it coming from? What are some of the symptoms, and how can you deal with it? I'm very glad that I have Dr. Mohamed in studio to help us talk about this. Good afternoon, Doc. Thank you so much for coming through.
Thank you so much.
I know I shortened it when I said gas. With all your scientific terminologies, please tell us what gas is in regards to its full name and what is it?
Gas meaning abdominal pain. Abdominal pain has a lot of causes. But our topic today is the most common issue and most common problem facing us in outpatient clinics. This means heartburn, okay, regurgitation of food. The terminology we are calling as gastroesophageal reflux disease, reflux esophagitis. Reflux esophagitis means that there is a backflow of stomach content of the esophagus, which is unusual or abnormal, as this is not the usual site of gastric content to come up with the acidity, with gastric acids causing inflammation in the lower esophagus. This is the problem. This causing heartburn. Regurgitation of food means that when we swallow the food, after we swallow, the food come up again in the esophagus. And sometimes patient come complaining from bitter taste in his mouth. Sometimes also dysphagia. Dysphagia means difficulty of swallowing, or odynophagia, painful swallowing. This is the problem.
Okay. All right. So Doc has laid the foundation for us on what gas is. And remember, this is an interactive program, so the number to get us on will be beamed on your screen in a few minutes. And get in touch with us when you, of course, get to your phones. Please remember to turn down the volume of your TV set so that we can hear you clearly. This is Doc on Air, and we are talking gas. Now, Dr. Mohamed, you've told us what this is. But what causes, I know in explaining what it is, you touched a bit on what causes this.
Yes. The most common cause we facing nowadays is obesity and overweight. This is the most common, as obesity causing increasing in the intra-abdominal pressure, which makes the cardiac sphincter. Cardiac sphincter means the lower esophageal sphincter between the esophagus and stomach to be weak. So this causing the contents of stomach to come up. This is the most common cause.
So when you say obesity, which is the most common cause,
yes.
How do I know that I'm obese?
We calculate what is called body mass index. Body mass index means weight in kilogram over height in meter square.
All right.
If everyone can calculate, if you are above 30, you are obese. From 25 to 30, it is overweight.
Please repeat those figures. 30?
Yes, above 30, obese.
All right.
From 25 to 30, it is overweight.
Okay, all right.
Okay?
Now that we know what it is and what causes gas, you talked about the one we're talking about being the most common. What does it affect? Where is it? And how does it manifest itself? So maybe we'll talk about where it is first.
Okay.
Which areas it affects in our body?
It affects the lower end of esophagus mainly. But this can be manifested by, as I told before, heartburn. This is the most common symptom. And the regurgitation of food means the food come up to the esophagus and sometimes to the mouth, causing bitter taste, some acidity in the mouth, full smell in the mouth, sore throat. Sometimes there is extra intestinal or extra gastric manifestation. Respiratory, it comes with manifested with respiratory symptoms like chronic cough, okay, and chronic laryngitis, sometimes wheezes, asthma, and hoarseness of voice. Hoarseness of voice means the changing of the voice, changing the note of the voice. Sometimes otitis media, it can cause pneumonia. So sometimes the patient go to see another doctor, not gastroenterologist. Maybe ENT doctor, pulmonary doctor. So it has many manifestations, but mainly it is gastrointestinal and sometimes manifested by extra gastric or extra GIT manifestation.
Okay. So when we see where this affects and the symptoms you've talked about, heartburn, bitter taste, chronic coughs and others,
Yes.
you can easily not know that you are having gas, isn't it? Because sometimes you might think it's just a cough. How do you then know the connection? Is it the perpetualness of these symptoms? Is it how long they take to, maybe how they manifest themselves? How can you know that this is maybe just an innocent, well, there's innocent heartburn,
Yes,
that is.
yes.
How do you know the difference between all these symptoms and them being connected to gas?
Okay. For heartburn and the regurgitation, it is GIT symptoms, so it is clear. The doctor can know. Sometimes, if respiratory symptoms like cough, like hoarseness of voice, or like asthma, it will not respond to the treatment for these causes, not responding to cough treatment, to cough syrup, to bronchodilators, to mucolytics. This usual treatment for respiratory symptoms, the patient will not respond.
Okay.
So he will take treatment for many days, for 1 month with no response. So I will suspect that he has another problem,
Alright.
like gastroesophageal reflux disease.
Okay. What about the age range? Can gas start from babies all the way to adults?
Most commonly from adolescents. Maybe sometimes if there is, as we see, obesity is widespread now, even in kids, so we can see it in kids also, but it can be in every age, or from kids to up to old age. No age, no specific age.
Okay. Let's talk about the how common this is in society. How many people are walking into your office, though, to talk about gas?
It is a very common problem. We can say for each 10 patients, about 6 to 7 patients complaining from this issue.
Is
and
this
in United, as we talk in United States, about 9 or 10 million per year visiting the doctors because of this problem.
Is this something that has become more common with the change of time, or it's always been like this and it's something that the medical field has always had to manage?
This problem comes from, as I told, the widespread obesity, fast food, change of our lifestyle, sedentary lifestyle, all this causing this problem.
All right. What about when you look at how to prevent this? How do we prevent this? Apart from, of course, not being obese.
Yes. We can prevent it by eating healthy food, taking small frequent meals. This is advice to take small frequent meals instead of 1 or 2 large meals per whole day. This is causing that the intra-abdominal pressure, the stomach become full, and the acid and the gastric content start to come up. So we advise to take small frequent meals to reduce weight, to not to eat and sleep. We have to take a space 2 to 3 hours between the last meal and sleeping. Okay, to elevate the head of the bed at night, especially to be not to lie flat, to be about 30 degrees. This all are helping to reduce the symptoms, and also to avoid some food, especially oily food, okay, fried food, peppermint, chocolate, coffee, citrus fruit, all this causing reflux.
All right. Let's talk about treatment. What is the treatment for gas?
Number 1 is a lifestyle modification, what we advise now. Second, it will be medicine. take what is called proton pump inhibitors. This is a group of drugs that inhibit gastric acid secretion. And we can take also what is called prokinetics. It is another group of drugs that improve the motility of the stomach and improve gastric emptying. Okay, this is the main groups. Sometimes we can take symptomatic treatment like antacids, but this will not help much, just for temporary relief.
Okay, and when you talk about antacids,
Yes.
I see a lot of people walk into the pharmacy, get some milk, get some antacids.
Yes.
What would you say about self-medicating when it comes to dealing with gas?
No, you have to consult the doctor. If this problem is recurrent and persistent, you have to consult the doctor, not just taking treatment from the pharmacy, as there is some complications that may happen from this problem, especially esophagitis, sometimes vomiting of blood. This may lead to what is called changing of the lower esophageal tissue, the nature of the tissue, become another tissue that may turn after that to malignant adenocarcinoma of the esophagus.
All right. Okay.
So we have to consult a doctor if the problem is persistent.
It's always safer, isn't it?
Yes.
You are watching Doc on Air. We are talking gas. We are with Dr. Mohamed, and of course a specialist in this field who can help you when you get to the hospital. Get in touch with us. Remember, we are live from the Mass Media Complex. Get in touch with us from using the number that's on your screens. If you want to give us a question, you've got a comment or a contribution altogether when it comes to the issue of gas. You've talked about self-medicating and the dangers and what repercussions can come out of that. What about home remedies? Because in society we have all these things of, you know, your grandmother telling you this, your aunt tells you, well, you don't need to actually, for now it's not too bad, drink some hot water with this knot. What would you say about home remedies though?
Sometimes it helps, but as I said, if the problem is recurrent and persistent, we have to consult the doctor.
And then there are times that a patient lets this run and doesn't come to the hospital, and it gets to, is there anything for gas like it's too much and it's not treatable, or every level or rate at which this gas gets to is treatable?
If he don't go to the hospital.
And then it gets to a very high level, where, you know, they start feeling pain, or the acid feels too much. Is there a point where gas is not treatable and it's something that you need to take medication through and
It is
through?
treatable by lifestyle modification, medicines. It is treatable.
Okay.
It is treatable. We can prevent it. We can control.
All right. You were giving us figures earlier on to say if you had to give it a rate from out of 10, 7, 6 people come with this issue to the hospital. What about the response that you know, society is giving this? How are they responding to issues that are leading to gas? When you tell them, does it reoccur? Do you have patients walking in with the same issue again?
Yes. Sometimes this manifestation because of other problem or because of other diagnosis. So if there is no response after at least 1 month of lifestyle modification and medication, you have to go for endoscopy. Endoscopy is a flexible tube. At its end there is a camera and light source entering from the mouth while the patient is receiving anesthesia. It takes about average 20 minutes, 30 minutes and this picture will be reflected on a screen, so we can see what happened inside. And sometimes if we can take samples or some biopsies from the mucosa itself. As there is other causes of esophagitis, not only reflux. Sometimes infection, sometimes there is non-steroidal anti-inflammatory. It's a type of medicine, a type of painkiller that cause harm to the mucosa and cause ulcers, erosions, inflammation. There is multiple causes causing this problem. So if there is no response to treatment, we have to go for endoscopy to see what happens inside.
All right, okay. Let's get to our first caller, Dr. Mohamed. We have a caller from Chililabombwe. Chulu Duncan, you're through to Doc on Air. Thank you so much for calling. Go ahead with your question. Hello, Duncan, go ahead with your question. Okay, so he's asking about the complications and what causes it. Probably as we were starting, he must have missed it. So for his sake, please go through for him. So what it is, what causes it, and the medication actually.
The causes, as we said, obesity. Sometimes hiatus hernia. Hiatus hernia means that the esophagus is passing through diaphragmatic opening. This opening become weak and wide. So this also causing reflux esophagitis. This is the causes. Complications, esophagitis, abdominal pain, sometimes change in the tissue like Barrett's esophagus. Barrett's esophagus is a precancerous condition. So we have to take care if the patient, if we found patient have this problem, we have to make endoscopy every 3 to 5 years as a follow-up and take some biopsies to make sure that there is no malignant change.
All right, he asked on medication.
Medication, proton pump inhibitors as pantoprazole. This decrease gastric acid secretion, and we take also prokinetic drugs that improve the gastric motility and improve gastric emptying.
Okay.
And sometimes antacid for temporary relief till this medication make full action.
All right. Okay. You are watching Doc on Air. Our topic for today is gas. We have Dr. Mohamed in studio to help us understand fully what this is and what it can do to you. We have another caller on the line. Hello, you're through to Doc on Air. All right, we missed that one. Remember, we're coming to you live from the Mass Media Complex. Get to your phones and get talking to us using the number on your screens. All right. But when you talk about, you know, how this comes on, is there anything with it being genetic?
Genetic, not genetic, it is mostly environmental because of our lifestyle, not genetic cause.
Okay, all right. And we have people who, I've seen people who are slim, but they still complain of this gas. Could it be just maybe the food that they're eating?
The food, yes, maybe has hiatus hernia. Hiatus hernia means that there is defect in diaphragm.
So which are the no foods? Which are the foods that you could eat that are healthy? So let's start with the food that you should avoid altogether to not cause gas. And then if you have gas, what then do you not eat and you stay away from completely? We'll be talking about that one, Doc, after we get our caller right now who has come through. You're through to Doc on Air. Hello, you're through to Doc on Air.
Hello.
Please go ahead with your question or contribution.
Good afternoon, doctor.
Good afternoon.
Yeah.
Yes, go ahead.
I'm hearing you.
Yeah, you're talking to Kerabai from Western Province.
All right, Mom Kalebai, please go ahead.
Yes. I just want to add on how to prevent that gases.
Okay, please share.
Yes. You may find that in some remote areas, some people they don't know how the main symptoms. So maybe the doctor can tell us what the main symptoms are.
All right.
Which causes those gases.
All right. Thank you very much.
Thank you.
All right. So he says some far-flung areas don't get this information as often as they should, and sometimes maybe when they get to want to hear this, they don't. So for him, Mr. Kaleva is asking about the symptoms.
The symptoms are most common heartburn, then regurgitation of food, better taste in your mouth, sometimes feeling difficult swallowing, you feel that the food stuck, or you feel it stopped in some areas. Also, sometimes nausea, vomiting of blood. This is the most common symptoms.
All right. For regurgitation of food, meaning the food coming back up, is it?
Yes, yes.
So you have a meal, and then after you after a few minutes, the food comes up.
Yes, that's
Well, the thin line between burping and regurgitation, those two. What is that thin line? Because others would think I'm probably just burping.
No, burping means mostly hiccup. But regurgitation means that you feel acidity or acid coming up in your esophagus, in your chest, causing burning pain. This is the difference.
All right. Before we went to our caller, Doc, you were about to start talking about food. Firstly, which foods to avoid so that you don't get gas, and then after you are a patient, which ones to stay away from. So this question is in two.
Number one, to avoid spicy food, chili. This is the most common cause of this problem. Oily food and fried food, better to get boiled or grilled. Okay. Better to avoid also oily food, fatty meals, fast food, carbonated drinks, citrus fruit, also peppermint, okay, chocolate. Sometimes a lot of garlic, onion, tomato puree on the food cause this problem.
Right,
So
okay.
this is the most common food to avoid. Try to not to avoid, to reduce, and coffee also. A lot of coffee cause this problem.
All right. How much is too much of this food? Because I know people out there who love spicy food,
Yes.
and fast food is everywhere, in every
Yes.
corner. So how much is too much? How do you gauge to say, well, if I eat fast food once a week, it's too much, or that's enough? If I'm going to have spices in my food, this is how much I should put.
According to the complaint or to the symptoms, if you complaining this every day, so better to avoid completely, or to be every 1 week, once per week, once per month, according to the situation of the patient. Not a fixed rule.
Okay. So depending on the intensity of how much gas do
That's
you
right.
have, is it?
That's right.
Okay. All right. We have another caller on the line, Doc. Hope Muchind is calling us from Livingston. Hello.
Hello?
You are through to Doc on air. Please talk to the doctor.
Yeah, I'm Aubrey Muchengo.
Yes, Aubrey, please go ahead.
Yeah, I just want to ask,
Yes.
what causes somebody to urinate red urine?
What causes?
Somebody to urinate red
Okay.
urine.
Okay, thank you very much, Aubrey. Even though we're not talking about that, but
It's asking about red urine.
you don't hold on. Just don't go. Yes, passing review.
Okay, thank
It's
you.
the most
Do you
common.
have any questions for
You
him?
have to
before we leave?
exclude that is blood. So you have to consult a urologist. Okay? You have to, maybe it is blood.
Okay.
So you have to take care and
Oh, the
consult a
diff-
doctor.
Oh, because you can't tell if it's blood or maybe there's just a color difference in urine.
Yes, yes.
Okay, so
And
what should he do?
some food may cause this also. But we
Okay.
have to exclude that this color is blood. We can make urine analysis, we can consult the urologist. Sometimes make scan, ultrasound to exclude any renal stones or infection, inflammation in the renal system.
Alright. So with the naked eye, you can't tell if it's maybe you just had beetroot, and
Yes.
you know the beetroot has caused your color to change. You can't tell with the naked eye until you go to the hospital.
But if he is eating this just before he sees the red urine, mostly it is because of food. And we can follow up if it is recurrent. It will be from another cause, not the food or not the drink he take. So we have to exclude that this is blood.
Alright, okay. You're watching Dog on Air. We are talking issues of gas, and I know that Aubrey there has something slightly out of our topic, but the doctor has responded saying, check the food you're eating. Can it cause color change during the chapasing, or it could be blood, which could be very dangerous. Please get to the hospital so that you eliminate all those issues. Otherwise, our topic for today is gas. Doctor has defined it, told us why and how, and of course, when it comes to treatment, how best to treat gas. You can get through to us on the number that is on your screens. Get to us, tell us your question, your contribution, or even a comment if you like. We have a caller from Luapula. Good afternoon, you're through to Doc on Air.
Good afternoon, madam.
Yes, madam, please go ahead.
Yes, this is a caller from La Province. Madam, I just wish to find out the connection between beans, the beans that we eat, and gases. Because usually people complain to say when they eat beans, they have problems in their stomach containing gases. So I wish to find out, madam, because if I experience the same problem. Thank you, madam.
All right, thank you very much. Okay. The examples we were given, Doc, when we were talking about which foods to stay away from completely, she brings out the issue of beans, and she says that whenever she has beans, whenever she eats beans, she has this problem of gases. Is it because of the beans? What's the relationship? Beans versus gases, so to say.
Okay. First of all, gas is a very general term. Include all the causes of abdominal pain, but we are speaking about heartburn and gastroesophageal reflux. So gas is a very general term. Sometimes gas because of gallstones, maybe hepatitis, maybe renal stones. So it is a very general term. So we have to differentiate, talk to the patient, and to get full history and what is the symptoms specifically he complained from. About the beans causes some gases, and this because of what is called irritable bowel syndrome. Irritable bowel syndrome, that the patient feel abdominal pain, gases. Gases in medical term means that there is abdominal distension because of much gas. Okay, so gas in medical term it is gases, not abdominal pain. It is gases. Means abdominal distension. There is much air inside our bowel, causing abdominal enlargement, distension, pain, sometimes diarrhea, sometimes constipation, and it is also a very common complaint from the patient that they have gases or pain after eating beans. So it is cause of irritable bowel syndrome. This is another functional disorder of the colon,
Okay.
not related to reflux.
Okay. All right. So if we say, so there's no, does it have the direct impact? Eat beans, you get that.
No direct impact, but the nature of the food itself. Also sometimes not beans alone, sometimes cabbage, cauliflower, lentils, all these causing gases.
All right. We have another caller from Mufulira. You're through to Doc on Air. Talk to us. Talk to the doctor.
Okay, good afternoon, Doc.
Good afternoon, how are you?
I'm alright. My name is Jeremiah, calling from Mufulira.
Yes, please go ahead.
I'm a patient of gastroesophageal disease. Now, is that disease, is there any permanent medication to end that disease? Because I am on, what's this?
The medication?
Yes. Yeah.
You are already on medication or you want to take medication?
No, I'm on medication for almost, this is almost 2 years now.
Okay.
How often do you go to get your medicine, or how often do you need it?
Well, I take it every day. I go for review after 6 months.
Okay. Doctor, is there a question you have for him before he goes?
Which type of medication?
Omeprazole.
Omeprazole. Sometimes we need to change the medication, so you have to consult a doctor And if there is no response, we will need endoscopy, as it is a very, very long time to have medication and no adequate response. So
The endoscope, I've done already endoscope. That's what they first did on endoscope. I did that.
you did it already.
Yes.
And what was the
That's
findings?
that's when they discovered that there is got that disease.
Okay, okay. So we need to change the medication.
So does he need to go back to the hospital
Yes,
to have?
we need to go back to the hospital to see what is the problem.
Alright. Alright, so
Okay.
probably go back to the hospital, tell them the medication, a bit of history. I don't know if you've been going to the same hospital, probably a
No,
bit
same
of
hospital.
different hospital,
No, same hospital.
same hospital. Maybe
Yeah.
give them a history of what he's been taking, doc. What does he do then? When he gets there, what does he tell the doctor?
You will say to the doctor that I am taking this medication for 2 years and no response. So he will change the medication for you and may add another group of drugs that may help to improve this problem.
Okay.
And you have to strictly follow the instruction for lifestyle modification.
Okay.
It is one of the main treatments. This is the first line of treatment to change your lifestyle.
Yeah, I know. That try to follow that.
Yes, yes.
Nimblumlalesa not my fast foods.
Oh, now you're going to stop that.
Is it? Alright.
Yeah.
Okay, please go back and just have thorough test as well, just like the doctor has said. Talk about the medication and we wish you the best.
Thank you very much.
Thank you for coming through. You're watching Doc on Air. We are talking gas, and doctor, you've made it clear that gas is a general terminology, but when it's broken down, break this down for us. What type of gases the gastritis falls in which, and it gives you what symptoms, what type of pain?
According to what I hear from the patient, gases means abdominal pain. They mean that they have abdominal pain. Abdominal pain has many causes. We can say gastritis, esophagitis, gastroesophageal reflux, cholecystitis, gallbladder stones, renal stones, renal inflammation, maybe some urinary tract infection. Okay, so there is gynecological problems also cause abdominal pain. So there is many causes of gases, irritable bowel syndrome, many causes.
All right, okay. What about the type of pain? I know it's a bit difficult to describe pain in terms of what type of pain does gases cause, or what comes out as a result of this. How can someone differentiate the type of pain they're feeling?
Yes, according to the cause. So if we go with gastritis, esophagitis, gastroesophageal reflux, mostly it will be upper abdominal pain, central upper abdominal pain, and it is burning in character. Okay, this is the most common. For gallbladder diseases, it is cramps. You feel like twisting or cramping, maybe radiated to the right shoulder. Okay, renal stones also you feel cramps, twisting pain associated with sometimes nausea, vomiting, some burning pain, while it's urinating.
Okay, all right.
Okay.
Let's get to Chidila Momboy. You're through to Doc on Air. Talk to the doctor. Hello?
Hello?
Please go ahead and talk to the doctor. Hello? Hello, you're through to Doc on Air.
Hello, this is Madam Natasha Mwira.
All right, please talk to the doctor.
Yes, yes, I just want to know how can I control acid reflux.
Okay.
Hello?
Yes, we can hear
Yes,
you.
I hear you.
All right, so how you can control acid reflux?
I have been suffering from this like for a long time now.
Roughly from how long?
Since December.
Since December last year. All right.
Yes. And I fail to travel. I don't travel very far, whereby due to the bad roads. Yes, those bumps when I travel in the bus, I start vomiting.
All right. Anything you'd like to ask her, Doc, before she goes?
No.
All right, Natasha. Just hold on and you listen to the doctor's response. Doc, she talks about how to control acid reflexes, and then this started December last year, and now it's gone on to the extent of when she travels, having just the bus or the car vehicle she's in hits a bump, she vomits.
Number one, as we said, lifestyle modification, to take the medication. Before travel, she has to take very small meal, not large meals.
How small is small, Doc?
Small means I can't describe, but small, not to feed your stomach.
Just enough. Okay.
Yes.
All right.
Very small meal, not to feed your stomach. That's my advice.
From last December, she's been suffering from this. Is that something
She
to
has
worry
to
about?
consult a doctor. It is
Okay.
also a very long period.
Okay. Does the same go to the controlling of the acid reflexes?
She can take antacids as a symptomatic treatment. She can take drugs which controlling or decreasing the gastric acid secretion, and anti-emetic or anti-vomiting before
She
she
travels.
travels.
Okay. We have another caller from Ndola. You are through to Doc on air. Talk to the doctor.
Okay, thank you. I wanted just to give a little contribution to that one who asked about the bill.
Okay.
I don't know what the effect of the people being getting problem with that, but they helped me, and what I did, just if you want to eat bill, put a little chili in bill.
You do. Please repeat that. When what do you do for you?
If you want to eat bill, to avoid that, put a little chili.
All right.
You can't have any problem. So they told me I did that. So for now I can eat this any quantity, any time without any problem. Send that person to those who have the problem with that. They can put chili in this and they will stop those problems. They will never get problems.
All right. Thank you very much.
Thank you, madam.
All right. So our caller from Ndola there has found sort of, an unconventional way of dealing with how he can eat beans minus having what, which is quite the opposite of what you were talking about, not having to have spicy food, but then he puts chili in the beans and it helps him. Is it?
It is strange.
It is strange. The unconventional way, is it?
Already some people can tolerate. Some people can tolerate, and some people have what is calling hypersensitivity, or they can tolerate spicy food.
Okay. When it comes to medication and it being relative to, I don't know if it's blood type or a person, how intense is that when dealing with gas?
The medication.
If I can take a medication, does it work for me? And then Abram takes something, or common person takes something, and it works for him. Is that very common?
Yes, sometimes.
All right, so it depends sometimes with the blood group, you test it.
Yes, not the blood group, but the condition of the patient is not related to the blood group, but mostly related to the condition of the patient.
Okay, I ask this because I'm thinking he takes beans and puts chili, it works, and then for the other person, it doesn't work, or...
No, the beans and the chili not related to gastroesophageal. It will not improve.
All right, okay. We have another caller from Ndola. You are through to Doc on air. We are talking gas.
Hey, my name is Mohamed calling from Dora.
All right, Mohamed, please go ahead and talk to the doctor.
Okay. Doc, what about in a case whereby a child has got cerebral palsy and then each time you're feeding the baby, she's throwing up and then she has got GERD. How do you go about it? Because what I've discovered is that cerebral palsy hasn't been taken care of, especially in our country.
All right. So you said, how old is the child?
She was born at 3, and then she's 3 years plus.
3 years plus.
So it's not like, yes.
Okay, cerebral palsy, and you mentioned something else we didn't get there. You said when you're feeding, is it a girl or boy?
The child throws up most of the time. She has been throwing up from the time she was born. Yes, I've been going to see doctors. They recommend, I don't know what to add. At that I don't know that drug. I've forgotten the name.
Okay.
That's what I've been giving the child. But they usually tell me that if the child is doing that, just give her the medicine.
Okay. Does she vomit every time you are feeding her, or it depends on maybe types of food?
Every time, like when I'm feeding her.
All right. Okay. Anything you'd like to ask her, Doc, before she goes?
I can't hear well what is the problem.
Okay. So just hold on, Mohamed.
Okay.
Mohamed is saying her child is 3 years plus,
Okay.
has cerebral palsy, and every time she's feeding the child vomits.
Mm.
And that I was told that she has got jade.
Jade?
Yes.
Okay. So plus jade. Anything you'd like to ask her before she goes?
No, I might advise to consult a pediatrician specialized in neurology.
Neurology.
Okay.
Yes.
All right. So when you go to the hospital, Mohamed, just see a pediatrician with a specialty of neurology.
Neurology specialist.
Okay.
All right, Mohamed, thank you so much. All the best.
Okay.
All right. You are watching Doc on Air. We are talking gases. If you want to be part of the conversation, get to your phone and kindly reduce the volume on your TV set as you have a conversation with us. But, Doctor, when you talk about gases, when you look at what causes it, how it, progresses, the risk factors, more especially when you know that you already have gas. What are those risk factors?
List number 1. Okay. Second one, hiatus hernia. Maybe if you take a lot of painkillers, shelly food, oily and fatty meats. This is the risk factors. This is the most common.
All right. Okay. You are through to Doc on Air. We have another caller, Doctor. This is Maseka from right here in Lusaka. Talk to the doctor. Maseka, you have to reduce the volume on your TV set or else you have echoes.
Yes, madam. I just want to ask you. Okay.
Reduce the volume on your TV set.
I just want to ask you, what of ginger drink? It will cause the problem?
Ginger? As you want to take it as medication, or do you just love ginger drink?
Ginger drink or natural drink.
Okay. All right. What about it as in for something to help the gases?
Gases, if I eat or when I wake a hard labor, it will cause me this my lips, then at the backbone and the skin. It's like the skin is burning.
Okay, so Bamaseka musebeza ntchito bwanji ni ya physical maningi?
Okay, it is my pharmacy.
Okay.
Yes.
So mkamba at the end of the day, mkonda kumwa ginger, any ginger drink?
Yes.
Okay, all right. So thank you so much, Bamaseka. So he's a farmer. He does a lot of physical jobs around the farm, and he's concerned because when he hears you talk about having to have some frequent food which can cause gases, he says he's concerned about the ginger and some natural drinks.
Ginger, no problem to have ginger in moderate or normal amounts, not too much also. But
having it every day after work is too much.
It is not proven to make reflux or heartburn. But he can take it, but in moderate amount, not large amounts. Okay.
All right. I'll take you back to the treatment, Doc.
Yes.
I'm hearing a lot of callers come through and having had this medication, that medication. Does the medication of gases have a starting to say you're going to start with something less powerful, so to say, then it keeps increasing to something a little bit more powerful? How does it work in terms of what to take at which point?
No, we'll start with high dose. Then we start when there is improvement, we can start to decrease the doses of the medication.
All right, because depending on the change of the patient, or what determines lowering the dosage?
Lower according to the response of the patient, according to the response to treatment. If he is responding, we will decrease the doses, and some patients may need maintenance dose, but not large one, but it's small one, small dose maintenance. Maybe for months, for 1 year.
All right. What's the expected ideal treatment time or duration? If I got gases today and I come to your office and you're giving me treatment, what is expected as ideal? Well, probably to be depending on what, but ideal to say, look, you can't take this medication for more than 3 weeks, for more than a month. What's the ideal period for me to heal from gases?
As a start, we can take 2 months. 2 months. And the patient will start to have a response, feeling better after 1 week, 2 weeks.
Okay, all right. I'm hearing also some connection between the gas and urinating. Is there what is the connection there?
As I said, gas is a general term. So these gases or this abdominal pain, if the patient needs abdominal pain, may come from urinary problem or urinary tract problem, like infection, like stones, like tumors. There is many causes we have to investigate.
All right, okay. So from this conversation that we've had, Doc, what's the one thing, or maybe the few things that you'd want people to, society to know, our viewers, to keep in mind as regards to our topic for today?
To consult the doctor, to eat healthy food, reduce weight, try to make some exercise, take small frequent meals, not one large meal per whole day. As we are working, we will not eat. Sometimes we forget to eat. So better to take regular meals, not one large meal per whole day. Okay, and try to reduce the food we said that make problems. That's my advice.
Okay, and now when you're talking about, sometimes we forget to eat, or you have such long periods between foods,
Yes.
it reminds me of stomach ulcers versus, some type of gas.
No, the regular meals better for regular bowel habits, not causing constipation, not causing diarrhea. Maintain also the GIT motility, gastrointestinal motility. It helps so much. So we have to take regular meals, to drink water, at least 2 to 2.5 liters per day. This is a healthy habit. We have to keep it.
2.5 liters.
2 to 2.5 liters. Yes.
All right. Water intake. I've seen lately. I see people moving with a lot of, a huge bottle of water. So I think that's something that a lot of people are doing, especially here at my workplace. But
it's healthy.
it's very healthy.
Yes.
But the pain when you have stomach ulcers and the pain when you have the gas.
Sometimes fasting makes the pain, increase the pain. Especially if we have 2 types of ulcers. Gastric ulcer, there is, according to the site, we have gastric ulcer, sometimes duodenal ulcer. Duodenal ulcer is the first part of the small intestine after the stomach. Gastric ulcer the pain increase after eating. But in duodenal ulcer, the pain increase while we are fasting. This is the difference.
All right, okay. All right, Dr. Mohamed, thank you so much for coming through. And of course, when it comes to talking about these conversations, surely can go on. And some emphasis, Doc, when it comes to self-medication, because for gases, I've met a number of people who sort of have a go-to medicine
Yes.
from the counter, because once you've been given that medication from the hospital, I don't know if it's still safe to just now go to the pharmacy, because I was given this medication by Dr. Mohamed. When I feel the same pain, I just go to the pharmacy and buy. Is that advisable, or what would you say on that?
Sometimes in simple problems like acidity, common cold, the patient can use over-the-counter drugs. But if the condition or the problem is continuing, not responding to treatment, recurrent, persistent, you have to consult. As there is a problem, we have to see what is the problem, what is going on.
Okay, let's get our very last caller. You're through to Doc on air.
Hello, madam.
Hello, sir.
I'm calling you from Livingstone.
Please go ahead and ask.
Okay, about a month ago, I was admitted in hospital, so I was taken to theater where the endoscope was done. So I was told that ulcers. I was put on some medication, some pyrokit for a week, and then some omeprazole for a month.
Okay.
But I haven't just finished the medication. I'm down as I'm talking to you.
Still feeling the same.
I'm feeling the same, and I wanted to find out if at all there's a connection between ulcers and gases.
All right.
Because when the pain comes, it's too much, it's unbearable.
All right. Thank you very much.
Thank you.
I'm sure he missed it. We spoke about this, but please, for his sake, ulcers and gases, the connection.
Ulcers or stomach ulcers or duodenal ulcer, one of the causes of gases, the patient with abdominal pain. It's one of the causes. This is a connection.
Okay.
Okay. My advice to him to go back to the hospital and seek medical advice again, as he is taking treatment and he is not responding.
All right. Thank you.
For pyrokit or I see overuse of pyrokit. Pyrokit is a treatment for Helicobacter pylori infection, bacteria. It is a bacteria in the stomach causing gastritis, causing ulcers. It is overused. So we have to take care and not use antibiotics simple like this.
Okay.
As well, there will be resistance after that.
Very true.
So we have to, before we take the antibiotic, there is a strong indication.
Surely they want your service. You know, there's so much when it comes to gas. Appreciate. Maybe a part 2, who knows? Thank you.
You are welcome.
Thank you so much, Doc.
Thank you.
Dr. Mohamed has been our doctor on air. Thank you so much to all our viewers who called through. Appreciate. And let's meet next week again on a Sunday at 15 for another topic on Doc on air.